Hello everyone, I'm Zoromi Jessie Zimi from Christian Jandi College, MSW First Sem, Department of Social Work. Today we'll be discussing on the topic casework practice in hospital setting. These are the contents and the subtopic which we'll be discussing today, that is the introduction of social casework practice in hospital setting, role of casework in hospital setting, functions of casework in hospital setting, models of casework practice, psychosocial model, effectiveness of psychosocial model, conclusion and reference. So first of all, let us discuss what is social casework. It is the primary method and technique of professional social work, the art of helping individuals to work out better social relationship adjustment and helping individuals to use their own resources, both material and psychological. It also focuses on the individual to remove his difficulties which is arising out of personal and environmental factors. So according to Merrill Richmond 1922, he defines that social casework means those processes which develop personality through adjustment consciously affected individual by individual between men and their relationship. So let us now discuss the main topic, that is casework practice in hospital setting. Casework practice in hospital setting, it is a major component of social work in healthcare, and it involves the active involvement of the social caseworker in the treatment process, from the initiation of the treatment till the completion of the procedure, and even in the post-recovery period, it is essential. And social worker works with both the patients and their family members to bring harmony in their existing family conditions, as both the patients and their family members become very anxious and stressed as soon as one of the family members falls sick. Now let us discuss the role of social caseworker in hospital setting. The first is prevention. Prevention aims to reduce the incidence of disease or dysfunction in a population through modifying stressful environment and strengthening the ability of the individual to cope. Prevention involves the promotion and maintenance of good health through education, attention to adequate standard for basic needs, and specific protection against known risks. Treatment. It aims to reduce the prevalence number of existing cases of a disorder or dysfunction and include early diagnosis, intervention, and treatment. Treatment activities, they are mainly focused on individual experiencing acute symptoms, individual trauma, relationship problems, stress, distress, or crisis, and include family and group counseling. Rehabilitation, it aims at reducing the after effects of disorder or dysfunction and involves the provision of services for retraining and rehabilitation to ensure maximum use of maintaining capacities by the individual. Rehabilitation activities focus on clients who are disabled by mental illness and may include individual, couple, family, and group interventions to build knowledge and skills, provision of specialized residential, vocational, and leisure resources, and advocacy to ensure the development of needed services and to change attitudes. Counseling. Counseling workers counsel with patients and their families. They explain the nature of an illness and advise the patient and family on how to effectively deal with it. A medical social caseworker also serves as a grief counselor to help patients and families deal with the trauma of experiencing a chronic or acute illness. Care planning. Families and patients do not know where to turn to get medical care. A medical social worker assists the patients and families in finding and arranging services such as in care, nursing home, and counseling. Financial assistance. In acute and chronic illness are expensive. Families may not be able to financially provide for the care of the ill family members. So here, medical social workers refers and assist patients in obtaining financial assistance, food assistance, and healthcare coverage through city, state, and federal programs. Assessment. When doctors or nurses subject that a patient is severely mentally ill, is a drug addict, or is a victim of abuse, they enlist the services of a medical social worker. The medical social worker evaluate the patient and reports back to the hospital staff. So here, together, hospital staff and the medical social worker collaborate to find the best approach to help mentally ill, mentally incompetent, drug addict, or abused patients. Advocacy. At times, a medical social worker serves as a patient advocate. The medical social worker acts as an intermediary between the patients and the medical community. They are voice for people who have communication challenging. Without the medical social worker, the types of patients often falls between the cracks, their health and emotional needs unknown. Legal assistance. These are situations where a medical social worker must take legal action to protect a patient. When a medical social worker encounters situations where parents are unable or unwilling to care for their sick child or encounter cases of abuse, legal action must be taken. In these cases, a conservator, a power of attorney, or a public guardian may need to be appointed. Next, let us discuss the functions of social caseworker. Here, the functions of social caseworker assess the patient's psychological and environmental strength and weakness, and collaborate with the team in the delivering of services, assist the clients to cooperate with treatment, identify other professional services which can be provided to solve the problems of the client, serve as a broker of community services, participated in the community policy making process, and engage in research to assume as a broadening of the knowledge base for successful practice. The next is models of casework. Models of casework are framework that guide social workers in their interactions with client. It also provides way of understanding the client's problems and developing interventions to address them. Common models include the psychodynamic model, the behavior model, the psychosocial model, and the general system model. Psychosocial model. Let us discuss the psychosocial model, which is among the models of casework. That is, it incorporates or contains psychoanalytical concepts, which means it contains the treating mental and emotionally disordered person by making the patient express their feelings, their childhood experiences, and the dreams which it have occurred and which they have experienced in the past. It provides a way of understanding the client's problems and developing interventions to address them. And common models include and in the psychodynamic model, the focus is on the interaction between an individual, that individual's psychological development. That is, the development mainly focuses on cognitive, emotional, intellectual, social capabilities, and functioning of an environment lifespan from infancy till their old age. It emphasizes the importance of both, that is, the individual's internal experiences such as emotions, thoughts, and behaviors, as well as the external factors that impact their mental well-being of the client. Effectiveness of psychosocial model. Effectiveness. Here, the psychosocial model accounts for a broader range of factors than many other models of mental well-being. By understanding an individual's mental state in relation to social milieu, the psychosocial model works to dispel the myth that an individual's mental distress exists exclusively in the mind, independent of control or environment. And it works for the understanding of mental well-being opens the door for treatment modalities. So, as a result, a psychosocial understanding of mental well-being opens the door to treatment modalities that not only empower individuals who are facing the problems, who have coped up with the problems, but to develop cognitive coping skills, but also understand how their social context influence their challenge. Conclusion: social gaze work plays a critical role in helping patients and their families navigate the medical system. It also educates patients and families, counsel people experiencing emotional stress, and connect clients with resources. Therefore, social gaze worker must start by developing the skill and knowledge to be a patient advocate to solve the problems of the client and the person who is facing a mental disorder and an emotional depression. This is the reference. And thank you all for your patient listening. Thank you.